This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.
And that he didn't realize for like a couple of weeks that he was brushing his teeth with their cleaning toothbrush. And then she didn't realize when he told her that it had been her fault. That she just accidentally did that. Oh, just so gross, so cringy.
It's so gross. Oh. But I'm also wondering, am I the only one on the planet that doesn't clean anything with a toothbrush? Who has time to micro clean a toilet with a toothbrush?
Get your fine tooth. I used to have a toothbrush.
Welcome to the ZuLoo Pōōdcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humor, we aim to discuss and highlight the critical role toilets play in whisking poop out of our lives, the impact toilets have, or lack thereof, in the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
Hey, listeners, viewers, welcome back to the ZuLoo Pōōdcast. Another week, another awesome episode. You're here for laughs. You're here for weird facts. You're here to
make it all.
Make fools of ourselves while bettering the world. I don't know.
But you come away smarter, right? We've been talking about that.
Yes.
Don't
always,
you?
Yes.
Yeah, I do. And
if you're feeling dumber after the show, then we're doing something wrong.
And if I don't come away smarter, I am at least happy.
Hey, that will help you live longer. Smarter, not so much.
Yes, but happy, yes. And more fulfilled.
That's right.
A little bit of entertainment, you know.
That's right. Mixed with some stone cold facts.
That's right.
Well, today we had the opportunity to speak with Tosin and Dr. Franco out of Africa. They were some contacts that we met at the World Toilet Summit in Nigeria.
Yes.
And they help run an amazing foundation that is primarily focused around women's health, mother's health. There's a clinic. They just do a whole bunch of stuff, but I'll let them give you the rundown. But they're amazing, and it was a joy to talk with them.
It's cool to see, like in Nigeria, what a priority sanitation has become.
Yes.
And in this foundation, it was started by the former First Lady of Nigeria.
Yeah.
Toyin Saraki, if I'm saying that right.
Yeah.
And she kind of looks like Michelle Obama, but better looking, I think. I don't know. It's my opinion. But
there you go.
Yeah, we'll put a picture of her on the website. But
Michelle, you're beautiful, but you've been bumped from your First Lady beauty ranking.
You got the First Lady rankings, and
does she have her arms though? Because Michelle's got some killer arms.
Okay, well,
it's true.
This doesn't have her arms,
so we can't say for sure. We didn't get to meet her there,
So, but she's got some great looking pearls, and anyway.
But Nigeria is really like almost the next Singapore. Like I can foresee that being a future where it's just, for so long functioning at level 0 and with the right resources, the right people, the right motivation, which the Nigerian government really has and the people certainly have.
Yeah.
I mean, we could see a 180 turn in the next couple years. And that's so inspiring.
That's really exciting.
I mean, it's like priority 1 for the country. I mean, it really is. I mean, they were... When we were at the summit, you saw it everywhere. Like World Toilet Summit, and everybody was talking about it.
It's like Comic-Con.
Yeah. No, it was.
For much better cause. Yeah.
And come back to America, it's like, oh, nobody's talking about it. I was like, okay, we're going downhill.
Everybody's dressed up as Pikachu, and that's what we're excited about.
No, yeah, it's great. But yeah, the foundation, the Wellbeing Foundation Africa, just doing some great stuff. Not just about sanitation, but mainly women's issues and children.
Right?
Yeah.
But Tosin and Dr. Franco give us that lowdown. But what they didn't give us was poo news. And Darren, that's your job. So what's in the poo news?
Oh yeah, the poo news is front and center. So we've talked about I think we've brought it up before where, the if you leave your toothbrush, I mean, there's a little bit of controversy out there, right? As far as this whole issue regarding leaving your toothbrush in the bathroom.
Right.
And apparently it's back in the news, right? It's like we can't leave it alone, right? Raging debate, right? Anyway, this dentist in New Zealand, I guess he's got 1.2 million views on. He came on social media and was like, "Hey, you should never leave your toothbrush in the bathroom,"
or at least like exposed on the counter.
Right.
You shouldn't brush your toilet with the same toothbrush you brush your teeth with. That kind of viral.
No, just your toothbrush being in the vicinity of your toilet, right?
Okay.
Because it could get fecal matter, just microborne in the air, fecal matter on the toothbrush, right?
I have to pause you to tell you a story that I saw on social media.
Oh, I thought you were going to tell me about your toothbrush, but
no, my toothbrush is secured behind a cabinet mirror. I feel very comfortable with where it's at.
Okay, it's protected. Okay.
But I was listening to some social media influencer, and I can't even remember who it is right now, but all I can remember was she was on her Instagram story telling the hundreds of thousands of followers that she has that she accidentally scooped her cleaning toothbrush, the toothbrush that she deep cleans her house with, into her husband's mess kit. And that he didn't realize for a couple of weeks that he was brushing his teeth with their cleaning toothbrush. And then she didn't realize when he told her that it had been her fault. That she just accidentally did that. Oh, just so gross, so cringy.
It's so gross. Oh. But I'm also wondering, am I the only one on the planet that doesn't clean anything with a toothbrush? Who has time to micro clean a toilet with a toothbrush?
It's your fine tooth. I used to have a toothbrush. I used to have a car that had white wall tires, ancient. They used to have white walls on tires, and I would get out there with the toothbrush and clean it.
Unless mice are the ones cleaning your house, like a Cinderella situation. I just can't imagine anyone's actually cleaning.
I have a cleaning toothbrush, but
what do you clean with it?
Grout.
You clean your grout?
Yeah, if you,
I thought I was clean, but now I'm starting to question.
No, it's like your annual super deep clean. Where you're like, I got to take a few hours to get the lime scale off of my faucet, that kind of thing. That's what I'm using the toothbrush for.
Oh, okay. It's probably a good way to
scale off.
I guess it's good to
in the tight corners.
Recycle the toothbrush, right? Not toss it.
Yeah. But an old toothbrush, you're done with it.
I am not as neurotic as I thought I was. This is great news.
But there is a risk, right? That it could make its way into someone's
I keep mine, all my cleaning products are super separate from hygiene products.
Smart.
So that could not happen unless my toddler somehow got to it.
Leave it laying around. No.
Yeah.
So what did Dr. New Zealand?
Yeah.
Well,
what did he say?
He said, "Hey, you should never do this." But the reason why it's controversial is because we never did air this episode. But remember MythBusters? Remember that?
I remember MythBusters.
Okay.
It's a good show. Spent a lot of time watching
They did some scientific stuff over a 2-week study, and they actually measured toothbrushes next to the toilet, and then they had toilets that were on the other side of the bathroom. Behind a cabinet and all that.
Yeah.
And the result was there was no statistically difference between
I remember that.
And so they basically said, it's a myth, right?
Busted. Yeah.
So, and even the fecal matter that was detected on the toothbrush next to the toilet, it didn't have enough to make any sort of.
It wasn't a danger.
It wasn't a harmful level.
Yeah.
It didn't rise to the level that could hurt anybody. Right.
Right.
And so anyway,
there's probably fecal matter on here and everywhere.
I hate to think about it, but yeah.
Yeah. As much as I wash my hands, there might be a little. No. So anyway, it's I don't know. You shouldn't be worried about it. Obviously, you want to be smart about it. You don't just I'll just lay it on the back of the toilet.
So are we concluding with MythBusters?
Yeah, how much faith are we putting in those two dudes?
Viral guy.
Yeah.
Well,
what does he say? Does he concur?
If you believe MythBusters, right?
Yeah. Don't be worried.
Yeah, they kind of debunked the whole idea.
Yeah,
right?
They look like real scientists to me.
Right.
Are you being sarcastic?
I don't know what real scientists look like. I believed everything they told me when that show was on.
Me too.
I know. Yeah, you got to believe them, right?
They busted the 10-second rule.
But I'm thinking,
or maybe it was the 5-second rule.
But I think, anytime you want to like generate a lot of views, right? You got to throw out something controversial.
Absolutely.
Like, toothbrush in the toilet,
That was clickbait.
I know. So this dentist is, this practice is just blown up probably.
Because he said,
he plays on the fears.
He said you absolutely should not keep your toothbrush anywhere near your toilet.
Right. Which kind of in a broad sense makes sense. Well, what if it fell in? What if, you accidentally, your spouse or your significant other grabs it and uses it?
I've never been comfortable with those like toilet shelves, the giant racks that go over a toilet.
No.
Ugh.
But the premise was, well, this airborne fecal matter is going to get you, right?
It's going to get you if you breathe. I mean,
I mean, you're on the toilet. It's like, if it's coming up, you're breathing it in.
But it's like a lot of things like, oh, well, they'll see this and they're like, holy crap, I'm going to like put my toothbrush behind a...
Yeah, I have a lot of issues with this guy.
But, I don't know. I kind of believe the Mythbusters, but, they could be
It can't hurt to hide it.
It can't hurt to, not...
Just being like mindful of where you put it, probably, right?
Yeah, for sure.
And maybe change it out.
Maybe change it out.
If you're going to use it to clean the toilet,
then 100 points to you. I'm
then
very
you may put a big red X on it, like do not use. Do not put in mouth. Right. Anyway, so that's some controversy in the news.
Wow.
Let us know what you think, viewers, listeners.
Yeah, who's died recently from this?
Yeah, have you ever accidentally used your toilet brush as a toothbrush, or could happen?
I'm sorry if that has happened to you.
Yeah, no, I'm feeling bad. What is that actually? What is a legitimate concern for someone? I apologize.
So anyway, that's the, we'll put a link to the Mythbusters. We'll put a link into the,
the Mythbusters clip's like 10 minutes long.
I think we tried to like,
really
we're going to actually incorporate that Mythbusters into the show, but then it was so long that, we just decided not to air it. But anyway.
It's worth a watch though.
Worth a watch, let us know if you feel smarter after watching it.
So it's the episode where they like, put their hand in a box full of daddy long legs to see if it hurts. I know. It was
what?
Gross.
I've never seen that.
Because remember they said
one.
that daddy long legs' mouths were too small to bite you, so you never had to worry?
Yeah.
That myth was busted.
Really?
Did it hurt them?
Bit them?
Mm-hmm.
Somebody told me it was like the most poisonous
I've heard that too.
That's what I always heard in the 80s. And they might still be. Maybe they just don't transfer enough like venom or whatever, but they can bite you.
They can?
Mm-hmm.
Okay. Oh, they're kind of fun.
They are kind of fun.
Yeah, just bouncing along.
Yeah.
Anyway,
on that note,
that's the poo news. So
that's the poo news. Right on.
Yeah, let us know what you think.
No more airplane stories this week. I'm relieved. I can travel
nothing
safely.
Out of England.
And nothing out of England.
Silence out of England. Not for long. They're going to come up.
Yeah, they'll come back.
They don't stay out of the news for long.
Somebody's going to get arrested for a wet wipe. I know it.
Somebody.
They're going to show handcuffs, wet wipe criminal.
That's right.
They're going to get somebody.
Well, on that note, let's hop into our interview with Tosin and Dr. Franco.
Awesome.
Okay, well, Tosin and Dr. Franco, welcome to the ZuLoo Pōōdcast. We are so delighted to be talking with both of you today. So delighted to have the opportunity to learn more about the foundation and what it is each of you does. I'm wondering if you can give our audience just a brief introduction to who you are and your role at the foundation. Tosin, we'll start with you and then we'll go to Dr. Franco.
Oh, wonderful. Thank you so much for having us on this podcast. It's a pleasure being here and meeting Darren and Kesley. First of all, let me start by introducing myself. My name is Tosin Adebayo. I am the Program Partnership and Grants Lead for the Wellbeing Foundation Africa. The Wellbeing Foundation Africa, it was founded in 2004 by Her Excellency Toyin Ojara Saraki, aimed at improving health outcomes for everyone in Nigeria. I would allow Dr. Franco to also introduce himself and just himself further. Dr. Franco, you have the floor.
Okay, Dr. Franco Apiyanteide by name. I'm the country director and the national programs lead for the Wellbeing Foundation. In addition to what he said, our foundation is focused towards advocacy and improving the outcome of maternal and child health and the most vulnerable populations in Nigeria, Africa, and globally, one of the things we've been at the forefront is bringing social and behavioral change that are needed to address the rising communicable diseases in Nigeria. And that we have been doing with a strong background of what we call the Mama Care 360 and the personal social health education program we're implementing in school. And currently, we're also focused in scaling up the hygiene quest with our partner, Reckitt. Thank you, Anova.
Yeah, you guys mentioned that it was founded by the former First Lady,
Saraki.
Yes.
Saraki?
Yeah, Mrs. Saraki.
Yeah, so she started this while she was in the presidency, or was it after that?
She started it while she was the governor for one of the First Lady for Kwara State, I believe. So she started, Her Excellency started the foundation as a result of her personal goal as a result of her personal experience. If Her Excellency too was looking to ensure that she will work towards reducing the maternal mortality rate in Nigeria, and herself too, she also has a personal experience from this when she lost, one of her child as a result of lack of education around proper care of a child. It's mostly as a result of her personal conviction. So she's much more emotionally invested in the foundation, emotionally invested in promoting good health and well-being for everyone in Nigeria and across the world.
Okay, in addition to what Tosin said, she strongly believes in the power of health education using midwives that are trained to promote knowledge of mothers on maternal and child health, and also best practices when a woman is pregnant, including teaching them various topics on antenatal, such as the danger signs in pregnancy, and making sure women deliver in health hospital where they will be taking care of midwives. The other thing we've been doing is also to train government staff on various skills that are needed in providing quality maternal and child health. And during this period, we've done training on various key topics as well as training on V-scan, as in how to use scan. In addition to that, she also strongly believes in advocacy. And in Africa, she is number one when it comes to promoting maternal and child health as well as the right of the girl child. This we have been doing over and over, and we strongly believe in our goal of ensuring the health and well-being of the most vulnerable population in Nigeria, Africa, and beyond.
Yeah, it's just touching that somebody would go so far to make such a difference for her country and the women and the children in her country. It's tragic that was, the foundation was born out of a personal experience. And sometimes it puts so much more power because there is so much more investment in it. So it's amazing what Her Excellency has done. It's amazing what your team has done. Dr. Franco, you mentioned earlier that one of your goals this year is centered on hygiene and hygiene awareness and education. Tell us a little bit more about what that looks like for the foundation and the people that the foundation serves.
Okay. In most countries, in low and middle income countries like Nigeria, our major challenge is that of behavior. So without addressing the behavioral issues we have, we'll keep on having high burden of infectious and preventable diseases. So in diseases like cholera, diarrhea, typhoid, enteritis, and even malaria are mostly transmitted through means that when addressed, these diseases will not be there. And they include basically hygiene. So we actually have a manual that the nurses and midwives use in training. In schools, our target is adolescents and young children. We train them early so that they will have the right behavior. They will have improved hygiene. Now, with improved hygiene, diseases like diarrhea, cholera, typhoid are addressed. The other thing is academic performance too will improve because there will not be days off due to absenteeism resulting from these infectious diseases. We are not limited in schools, in healthcare facilities too. We also help educate both healthcare workers on best hygiene practices and also pregnant and lactating mothers. We also help educate them on best hygiene practices. We strongly believe that, according to the World Health Organization, just by hand washing, you can address 50% of diarrhea cases. So when each time we pass on this message, over time, we've actually seen an improvement in hand washing and general hygiene. And with that, the burden of infectious diseases is being addressed. We are also not limited to healthcare facility. In communities, we are currently implementing activities in communities where we engage community members and we also teach them the same lessons we teach others. And with that, we are like driving a strong social and behavior change that will really, really promote an end to poor hygiene, an end to open defecation, and at the end of the day, improved health and well-being of the most vulnerable. Thank you.
Yeah, thank you very much. In furtherance, just also in addition to what Dr. Franco has said, Nigeria today, around 729 million people lack access to basic sanitation services. And likewise in school, the WashNorm data has now revealed that 53% lack access to basic sanitation services in schools in Nigeria. This was why we came out looking to achieve our behavioral change approaches. Yes, although currently we might not be looking to adopt other infrastructural developments in terms of providing basic sanitation services in schools, considering the limitation of funding. However, we are currently looking to achieve and reduce these indices by health promotion, which Dr. Franco has also emphasized. But there is one special thing our foundation does, and let me just say this out, is different from other organizations. What we do at the Wellbeing Foundation is we use our nurses to educate students in schools and adolescents.
Okay, currently 47 million Nigerians still practice open defecation. And this is basically because they lack access to basic sanitation facilities. So at the Wellbeing Foundation, we, apart from the social and behavior change components we are implementing, we also have some experiences in fixing basic hygiene structures. And we are fully open to partners to be able to scale up availability of basic sanitation facilities in schools, healthcare facilities, and also in communities. And currently, we are working we are in the process of, we are collaborating with Toilet for All to see how we can start implementing activities that focus in putting on basic structure for sanitation in schools, who are well trained to provide these activities also in community. And with this very approach, we are very sure that over time, Nigeria can be declared open defecation free.
Yeah, I know at the World Toilet Summit, there was a lot of energy, a lot of positive energy going all around with the involvement of both private industry, charities like yours, and the government's obviously emphasis on the issue. What kind of things have you seen since the World Toilet Summit in November of last year? Have you seen any sort of implementations of programs? Any kind of what kind of things are you seeing happening right now in when it comes to toilets?
Yes, we have begun to see changes, if not directly, but indirectly. Firstly, we've had changes in terms of commitments from governmental and non-governmental organizations as a result of the summit. Partnerships are being made as we speak, and I can even recall various organizations are now beginning to work towards ensuring that they improve the sanitation indices here in Nigeria. And I'm hoping, sincerely speaking, we begin to have investments in areas of sanitation, actually here in Nigeria.
So with political commitment after the toilet summit, by the end of this year, hopefully these very indices will improve. And we can tell confidently that the toilet summit delivered on its goal. For the Wellbeing Foundation, we met some partners like Toilet for All, and we've actually shared a proposal with them. And we're hoping that through this very meeting, there will be improvement in basic hygiene facility in schools. And that is one of the means to end open defecation. So in summary, the World Toilet Summit really brought about a catalyst in achieving open defecation and improving the sanitation condition in Nigeria.
What I love so much about what the Wellbeing Foundation does is its community approach. And I think that having the World Toilet Summit in Nigeria just reinforced your mission to the general public, right? You're talking about religious sectors and groups that are getting behind talking to their congregations. You're talking about public school systems that are getting behind education and building these habits, these healthy hygiene habits within their students. You're talking about generational behavior patterns taught from grandparents to parents to kids, or the other way around, right? From kids to their grandparents. And it's just a really holistic approach to take on such a large mission, because those numbers that you've talked about, 53% of schools or children lack access to safe sanitation. Those are really big numbers, almost so big to comprehend. But when you think about how many people there are in Nigeria and how many people you've educated and how many people one person that you've taught healthy sanitation habits to or hygiene habits to can go and teach, it just is this exponential effect of growing and improving public health sectors. So it's really a fascinating and phenomenal approach to seeing that spread like wildfire. I mean, just very, very impressive. I'm curious to know what that reception has been like from your nurses and midwives when they're out teaching. Is it a warm welcome wanting to accept these new hygiene habits? Is it met with some hesitation? What's that like in Nigeria?
Okay. The experience has been very, very great and encouraging, such that some schools are even requesting for a sustenance and continuation of the health education even after the project. And that we actually assured them we will do. So the knowledge student gain is very encouraging. even the teachers too, during the process, also learn. So on a general note, the program is welcome, well embraced by schools and also the government authorities. They are actually very aware, very keen, and very happy with the program. And that has also been an avenue for we to keep advocating, for we to keep educating and making sure that at an early stage, students have this best approach to sanitation.
And just to add to what my colleague has said, from a personal experience, when we go to the schools, you find out you see the children are always happy and elated to see us. They'll be like, how are you today, uncle, auntie, how are you? The reception is really breathtaking. And this is one of the things that makes you committed to your work, that gives you that personal conviction for the work you are doing. Without seeing these children happy, when we begin to see them happy, when they will come and they give us this one welcome, we are always more motivated to meet more adolescents. And I really love what you said, Kelsey. What you said about, yes, it's a fire approach, where it's like a burning fire. It's like a wildfire. A wildfire begins to go, you can't stop it. And that is what we are looking to achieve here through our approaches. We want a wildfire where a child, an adolescent can see a child and say, Daddy, you did not wash your hand today. Daddy, why didn't you wash your hand? Recall, when we were speaking, I was telling you I was just coming from a meeting at the United Nations in partnership with UNICEF, where we were working on a handbook for mother and child. We were working on the hand washing aspect of that handbook, and we had some quite interesting inputs from some of our participants. Someone shared with us, I was like, oh, my children now, they tell me that, Daddy, you don't know how to wash your hand. This is how you wash your hand. We were invited by the Ministry of Environment in the commemoration of the National Sanitation Day. And this was the first time we got invited by the ministry. And this was as a result of the recognition of what we are doing in areas of sanitation. Although we might not have all the finance, but we have dedicated staff that are looking to achieve change. And I totally agree with you. Once we target the adolescents, it's a wildfire that catches everyone at the end of the day. Thank you so much.
100%. Oh, it's such a joy chatting with both of you. And Tosin, just to speak to what you said, that motivation just continues to grow as well, right? When we see the effects, the positive effects that healthy sanitation or hygiene practices and safe sanitation, access to that, the positive stories that brings up, it just continues to fuel our desire to eliminate unsafe hygiene practices to help everybody be healthy and happy. So on behalf of ZuLoo's team, thank you for the amazing work that both of you are doing at the foundation, that all your educators, nurses, midwives, and everybody else involved is doing. It's just so phenomenal. Unfortunately, we're out of time, but we love chatting with both of you. Thank you so much for joining us on the ZuLoo Pōōdcast today. It's just been such a delight to speak with both of you. Well, that was Tosin and Dr. Franco. Aren't they gems? It was
gems.
Yes. Such a pleasure to talk to them. I mean, we just got off the interview and I texted Aaron and I was like, they are awesome.
Good energy.
Yeah. So much good energy. And I can tell how much they love the work that they do.
Yeah.
And how dedicated they are to it. Like lifelong dedication to this cause.
Mm-hmm.
Yeah, it's awesome to see that. I mean, they're so enthusiastic about it.
Yeah. So. And I feel like that's both difficult to find, that sort of lifelong passion and drive, especially in humanitarian work, because so many charities start and then end,
fizzle out,
start and fizzle out, and they do a little bit of work here and there, and then people move on. But that's what it's like for them at the Wellbeing Foundation. Just this true love for the work that they do and for the cause that they serve.
Yeah.
And even as Dr. Franco said, he has this really tender place for the founder and the mission that she had and wants to carry that on. And I just really, really admire that.
Well, I was impressed when in Nigeria, how much emphasis they place on family and just children and their well-being, right? That's like critical, right? And you just felt it, right? And so we had the opportunity to go to church with them while we were there, and they did a baby blessing, and they had like literally like 15 babies up there, and they're all dressed in their white, gowns, and everybody's like dressed. I mean, when I go to church, I look like a slob, but these guys they're decked out, right? And just, giving blessings to the babies, and it was fantastic. But yeah, just such a family focused culture,
Yeah. Yeah. And they're showing that care extends in both directions, right? From the elderly to the young, and then from the young to the old. And that's part of their model, which again, I thought was really novel, that they're teaching the children in hopes that they'll go home and correct these hygienic practices or these unhygienic practices in their parents and their grandparents.
Yeah.
Because they place especially a lot of trust in the youth that we're going to invest this time educating you in what is hygienic and proper and healthy. And you'll pay that forward by teaching your family and your friends and creating a community where this is applauded.
Right.
Or good hygiene is applauded.
Absolutely. Super great. And we're excited to work with them.
Absolutely. Absolutely. Well, folks, thanks for tuning in. We hope that you enjoyed this episode of the Poodcast. If you did, hit subscribe, share certainly to your social media channels. If you need to, send out an email. Snail mail doesn't matter either. We love it. Share the ZuLoo Pōōdcast however you like to share, and we'll see you next week.
Thank you for listening to the ZuLoo Pōōdcast. Follow us on social media at our links in the show notes below. To learn more, visit our website, ZuLoo.org. If you liked the podcast, be sure to subscribe, like, and comment. For even more ZuLoo fun, send us an email with your toilet stories to podcast@ZuLoo.com for a chance to be featured on the podcast. This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water, and sanitation through the power of social enterprise. Learn more at ZuLoo.com.